Hi everyone, it's Dr. Benjamin Allen, your Freedom Wellness Doc, board certified in physical medicine and rehabilitation, here to talk to you today about spinal cord injury. Recently in April 2025, actor Nick Moran, known for his role in the Harry Potter series, was sent to the emergency room due to neck pain and underwent emergency spinal surgery for what doctors discovered to be severe spinal cord injury. Now, spinal cord injury is an injury to the spinal cord that affects communication between the brain and the rest of the body. So, spinal cord injury is complicated and it can alter function in various ways depending on the severity of the injury. And we physicians like to use something called the ASIA impairment scale to grade spinal cord injuries. So, ASIA stands for the American Spinal Injury Association, and there are categories and levels of spinal cord injury to help us better understand the severity of someone's spinal cord injury. And spinal cord injury can occur for various reasons. Sometimes it's stenosis, meaning there's narrowing at the level of the spinal canal, impinging on the spinal cord and causing injury. There can be a mass growing there, pushing on the spinal cord, causing damage, trauma from a gunshot wound or a stabbing incident, or bone spurs, fractures. Multiple things can lead to spinal cord injury, and sometimes it can also be due to autoimmune disease that can affect the spinal cord. So just to briefly go through the levels to help you understand, it can be complete or incomplete. So those are the two major categories, and then we break it down by levels. So a grade A, complete spinal cord injury, means the person has no motor, meaning no movement, and no sensation or cannot feel anything below the level of injury. So if I said this person has a C4 grade A spinal cord injury, that means from the neck down, they cannot feel or move anything. Now, incomplete, starting with grade B, incomplete spinal cord injury, means they have sensory but no motor function below the level of injury. So they can feel, but they cannot move anything below the level. Grade C means they have motor and some sensory below the level of injury, with the motor function being half of the key muscles with a grade of less than 3. So if somebody has a muscle strength grade that's less than 3, that means they can move their limb without gravity. So if their hand is on the table, they can slide it out and slide it towards them, but they can't lift the hand off the table against gravity or bring their hand to their mouth. Now, if it's a grade D level injury, then they have motor function with a grade of 3 or higher, meaning they can lift against gravity or even stronger against resistance or have full strength with half of the key muscles below that level of injury. And then grade E means they have motor and sensory fully intact below the level of injury. Now, some common symptoms of spinal cord injury include loss of bowel or bladder function, sensory issues like stinging, burning pains, which is caused by damage to the nerve fibers, or hyperreflexia or muscle spasms, meaning their reflexes are hypersensitive. So you know that knee jerk that you get when the doctor taps on your knee? It's hyperreflexive. So it's like that foot is flying up in the air. Also, if it's a higher level injury, you can have problems with even swallowing or breathing issues because the muscles that are responsible for your breathing are weak. So it can be very detrimental to mental health when this happens because it is devastating. But there is hope. And I always want you to remember that. And caregivers, it's important that you provide emotional support. You join a community for caregivers of people with spinal cord injury. You encourage your loved one with spinal cord injury, or if you're the person with spinal cord injury, to join community. There are even clubs and sports teams where spinal cord injured individuals compete against one another. They even have a basketball league, which I participated in as a ref in Maryland, linked to University of Maryland. I don't have any particular affiliation with with them, but it's something I remember. So if you're in the Maryland area, you can check it out. But they have these type of organizations and opportunities available in various places, but you have to seek them out. So please join community. And if you are someone or a caregiver to someone with spinal cord injury and you need expert guidance, you want to book a consultation with a rehabilitation physician who is committed to partnering with you and helping you thrive in spite of your circumstances and increase your mobility, your level of independence, your functioning, your quality of life, I invite you to book a consult at freedomwellnessphysiatry.com, or you can give us a call at 240-339-5377. I'll be happy to work with you and join you on your journey to living better. Please subscribe to our YouTube channel where you can receive a wealth of information, educational content, and hear stories from survivors and people who are thriving with medical diagnoses that could be potentially debilitating and doing great things in the community in spite of that. And join our newsletter so that you can receive updates, promotions, and health tips along your journey. And as a thank you, I will send you my expert guide to the top 5 post-hospital pitfalls and how to avoid them. And you can click that link to join our newsletter list in the comment section below. And I'll talk to you guys next time. Peace.